Hi, Dr. Arika. Dr. Arika, am I pronouncing your name correctly?
It's actually Arathil, but I know it's difficult to pronounce, so just call me Irene or Irene as you prefer.
Dr. Arathil.
That's it. Perfectly right.
Oh,
Arathil.
listen, thank you so much for letting me steal some of your time today, because I know it's 7 o'clock, isn't it, in Spain right now?
Yes. Yes,
How
that's right.
how was your clinic today?
It was busy as usual, but I always enjoy having this appointment with my patients and the new patients that we have every day, and helping them through this process or assessing them with the potential treatments or the choices they will have to make in a near future.
Did you have lots of patients today who were starting IVF for the first time?
Just one couple.
Yes.
For the first visit, one couple, yeah.
It's always very, very scary, that first visit for the patient. It's a whole new world. But listen, today you're going to help me understand endometriosis. And usually when I do questions and answers with doctors, I've usually experienced the topic, whether it be you know infertility, IVF, ICSI, you name it. But endometriosis is a topic that I don't know about. I'm very lucky I don't know about it. I've never experienced it. Yeah. So I would love anybody watching who's got endometriosis to help me at one point, because I'd like to hear from people about how endometriosis feels. But we'll come back to that. Before we do anything, can you just tell me what endometriosis is?
Well, endometriosis is a chronic disease that affects women of childbearing age. Its prevalence, it's around 3 to 10% of women worldwide, so it's really a common disease. It's caused by the presence of endometrial tissue outside of the uterus. The endometrium is the inner part of the uterus. It responds to the sexual hormones, and it's the part of the uterus that detaches during the menstrual period. Okay, so when this tissue is located outside of the uterus, usually affecting the ovaries, the fallopian tubes, or other pelvic structures, it can cause a lot of inflammation and pain. Depending on these locations, we have different types of endometriosis. We have ovarian endometriosis, which is one of the most common types. In these cases, we may see endometriosis cysts or endometriomas, also called chocolate cysts, that affects the ovaries and are one of the main reasons why endometriosis is related to infertility. But we could also find endometriosic implants in other places, such as the fallopian tubes, the peritoneum, which is the layer that is lining the inside part of the abdominal cavity. And here we can see these endometriosic implants, and it can also affect deeper structures such as pelvic floor, the tissue that is in between the vagina and the rectum, causing this typical typical pain during intercourse. And also it can affect to other organs like the bladder, the intestines, and this is what we call the deep infiltrating endometriosis.
It sounds horrible.
It could be.
It sounds really, really, really horrible. Why does someone get endometriosis?
The origin is unknown, all right. But there are several theories about it. The most accepted one is the reverse menstruation theory, or Samson's theory, which says that during the menstrual cycle, the endometrial tissue that should leave the body through the vagina migrates backwards through the fallopian tubes and ends up in the peritoneum, in the pelvic cavity, where these cells have the capacity to implant and proliferate there. However, it's known that this reverse menstruation can happen in almost every woman in small amounts without causing any disease or implantation of this tissue in the peritoneum. So that's the reason why it's thought that there must be other factors such as immune factors, pro-inflammatory factors, and even genetic factors that must be involved in this process.
Wow, because I was just going to say to you, is it hereditary?
It is not hereditary because it's a polygenic disease, which means that there is not one mutation in one gene that can be passed from one generation to another and causes the disease. But it's been related to different genes that can be influencing this predisposition to develop endometriosis, and it's also more common between inside a family.
And a lot of people tell me that, you know, when they have been diagnosed, that it's taken them forever to be diagnosed. Why is it that it takes so long for someone to get that diagnosis?
Well, you're absolutely right. That's a very good point. I think that endometriosis is a very underdiagnosed disease, and it's common to see this delay of the diagnosis and treatment of even several years. I think that there are two main reasons for this to happen. One of them is the lack of specific training on endometriosis, especially in the ER services. And the second one is that it's quite common to underestimate menstrual pain. Like everything is normal, everything just needs painkillers, you know, everything will go away. The problem is that sometimes it doesn't go away, and the symptoms could be so limiting, debilitating, that it could cause health problems, mental problems, anxiety, even depression. So it's really a problem, this delay.
But is the actual test a complicated one? Is it complicated and expensive? Like,
no, not really. Okay, the main tools we have for the diagnosis is the ultrasound scan, and the difficulty for the diagnosis mainly depends on the location of the endometriosis. Through an ultrasound scan, it's really easy to see endometriomas, I mean endometriosis in the ovaries. We have a very good resolution of the ovaries in the ultrasound. But when we're talking about deep endometriosis, it may be very difficult to diagnose it or to see it in an ultrasound scan, especially if the implants are small. Sometimes they are tiny, but there are a lot of implants, but a small size. And in these cases, sometimes there is an MRI should be performed to help us with the diagnosis, with the diagnostic process. And sometimes if the symptoms are unbearable, it would be necessary to undergo a laparoscopy.
right. I had, I've got a friend who has had 3 failed rounds of IVF, and her, like every month, her periods were horrific. The pain, like nausea, passing out. And it was her acupuncturist that said to her, you are displaying classic symptoms of endometriosis. But that was, and she said, and it was only after 3 rounds of IVF that it took her acupuncturist to mention endometriosis. And her entire fertility journey was never mentioned, which I find really, really bizarre.
It's not common, especially if the endometriosis, as I said, is affecting the ovaries. We usually detect them easily. Do you know finally which kind of endometriosis they see?
I don't actually. I don't. I was interested earlier when you were listing the different types of endometriosis. You mentioned something, did you call them chocolate cysts? How can such a horrible,
it sounds
horrible thing
horrible.
have such a cute name?
Yeah, it's because the appearance of these endometriomas, the morphology is like a big dark brown cyst, which is full of this thick dark brown liquid. And in fact is all the blood, okay, that turns almost black, and somebody has the idea of calling this way.
Oh my God. Now there was Kelly earlier. I've just got to scroll back because Kelly says she has got, oh, where has it now? A lovely girl called Kelly told us what she has, and now I can't find it. Kelly, if you're still there, tell us what you have got. Oh, here we go. Oh God, hang on, I've got to put my glasses on. She's got, can you help me with this pronunciation? Adenomyosis.
Adenomyosis.
Yeah. So what's that?
Adenomyosis is a different disease.
Oh.
It's not the same thing as endometriosis, but it's kind of related, okay? It's also about endometrial tissue in some places where it doesn't belong. Endometriosis is endometrial tissue outside of the uterus, but adenomyosis is the presence of endometrial tissue in the muscular layer of the uterus, in the myometrium. So the endometrium kind of penetrates the upper layer of the uterus, which is this muscular part called myometrium. And it can also cause very painful periods and heavy bleeding, and it can cause infertility through different mechanisms, but it affects more the uterus itself, not the rest of the gynecological structures.
Look, we have somebody else here that says that she has it as well. Is it common?
Adenomyosis?
Yeah.
More or less as the endometriosis.
Yes.
Around 10%.
Oh my
God. A bit less common than endometriosis, I think, but easier to detect because the uterus is also easy to see during the ultrasound scan, and there are very typical obvious signs that suggest adenomyosis on the ultrasound.
So what I find so cruel is for those women who have, like the word I can't pronounce, the
adenomyosis
and endometriosis, and those women that have those and are trying to get pregnant and can't get pregnant naturally, I find it so cruel that they're struggling with chronic pain physically with their infertility, well, their endometriosis, and then the fact that they can't get pregnant naturally on top of that, I just think is the most horrible thing ever. But does endometriosis always mean that you can't get pregnant naturally, or are there women that have it and can get pregnant naturally?
Yes, 70% of women with endometriosis can conceive naturally and won't have any kind of fertility issues at all. But there is a 30% of women with endometriosis that would struggle with infertility. Yes.
So what do you do for those women, that 30%? What's the first thing that you would do if a woman comes to you and she's clearly showing signs that she has endometriosis and she can't get pregnant and she says to you, doctor, help me? What do I do?
There is some controversy about this topic. What in endometriosis we have two problems, okay? And sometimes we have to choose which one is the most important in this moment to us. There is pain and these severe symptoms, and it's infertility. Most of the treatments are focused on controlling the symptoms, the pain. But as a side effect are contraceptives.
Oh my God.
Medical treatment. The first line of treatment, okay, in endometriosis for women which is not trying to conceive in this very moment are contraceptive pills, okay, combined contraceptive pills in a continuous pattern to avoid having a menstrual period, or different types like progestogens or other treatments that kind of stop the ovary, okay. But these treatments are contraceptive. So if this is your choice, you can't get pregnant right now, okay? And the other problem is that sometimes all of this medical treatment doesn't work, doesn't improve enough the symptoms, and we have to go for a surgical management, which usually involves removing the endometriomas, the cyst, the implants, all the disease that we are able to detect and remove. However, this treatment helps with the pain, but doesn't help with the fertility. In fact, we know that the cystectomy, which is the removal of these chocolate cysts or endometriomas, cause a decrease in the ovarian reserve. Okay, because these cysts are inside of the ovary, are not close to the ovary or attached to the ovary, are inside the ovary. So it's really difficult to remove the cyst without affecting in some way, without damaging the healthy surrounding tissue.
Well, that's heartbreaking. That's really heartbreaking. So what does that woman do then? The one that wants to have a baby?
Yeah, I would suggest to go straight to a fertility treatment.
Yes.
There's no need for undergoing any kind of surgical treatment before, unless there is another indication like these unbearable symptoms, alarming signs like very large cysts or rapidly growing cyst.
Yes.
If none of these alarming signs, then what we should do is undergoing the average treatment depending on the fertility studies, the fertility test, depending on the ovarian reserve, if the fallopian tubes are blocked or not. With this information, if the sperm is okay, we would choose one treatment or another.
Yeah.
But it's true that the endometriosis itself affects negatively the ovarian reserve. So it's common that these women would need directly an IVF treatment.
Yes. Now, I was hoping that Tracy, who is the co-founder of IVF-Babble, she was going to join today, and I must actually just check, actually, because there is someone requesting to join, but I don't think it's Tracy, because she's got endometriosis, and I was hoping that she could join us to talk about how it feels, or, you know, because I know she experienced some really, really, really horrific side effects, actually. But because her story ends, well, it has a wonderful happy ending. She went on to have twins with IVF, So it's a great story, but I don't think she'll be able to join us because we've only got 5 minutes left. But if anybody who's watching does have endometriosis and wants to share just how it feels or a bit of their story, either now or send me a direct message. I'd love to hear from those women, because yeah, it's yeah, it blows my mind. And it's Endometriosis Awareness Month, so we want to hear from as many people as possible. Can it return once, if you do have surgery on it, can it return?
Yes, it can. Yes, endometriosis is a chronic disease. So most of the times the natural evolution of this disease is unpredictable. In around 0.5% of women with endometriosis, they would experience some sort of worsening over the years, while the other half of the patients will remain stable or even get better over the years. Yes, but sometimes we remove, for example, this endometrioma, and 2 years after she has another one.
So if anyone watching this back thinks, or hasn't been diagnosed with endometriosis and thinks, God, I wonder if I do actually have it, can you just recap some of the symptoms or the side effects?
Sure, yeah. The main symptom of the endometriosis is pain, severe pain in different situations. Menstrual pain is the most common, but really severe menstrual pain that doesn't really go away with painkillers, that it's kind of invalidating, or that can even prevent you from doing your normal activities, going to work. So yeah, a really severe cramps. It can also cause pain during intercourse. It can also show up as chronic abdominal pain, because sometimes this persistent inflammation inside the pelvic cavity causes the appearance of fibrotic tissue, and scarring, scars, and these adherences, which are like bridges between one structure and another. And these adherences can be really painful even between periods. And other less common symptoms are, for example, mictional symptoms when the endometriosis affects the bladder, or intestinal symptoms when it affects the bowel. Yeah.
So if you are experiencing any of those symptoms, get to your doctor and just tell them what you're experiencing.
Absolutely.
Yeah.
Absolutely.
But what I would like to take from this is the fact that it doesn't necessarily mean that you can't get pregnant naturally.
That's right. Most of them will get pregnant naturally. Yes.
Yeah, incredible. Well, look, I know it's nearly time to end, but I just want to say there is so much support out there for women who've got endometriosis. There's some incredible, on Instagram alone, there's some incredible accounts that I'll share with everyone. But for now, I'm going to have to let you go, because it is, like we said, it's 7:30 in Spain, isn't it? And please tell me that's the end of your clinic day.
Yes, it is.
Are you back in tomorrow for another full day?
Yeah.
And
here every day.
and I always like to ask the doctors if they've done any transfers today. Have you done any transfers today?
No, today I haven't, because I've had an hysteroscopy early in the morning, so that took my whole morning.
Oh, wow! How long does the why can't I speak today? Hysteroscopy. How long?
Hysteroscopy. It depends on what are you doing inside the uterus. Depends on the kind of surgery, if it's a fibroid or a polyp, or you're just taking some samples.
Yes.
It depends. It can be really quick or a bit long.
Yeah. Gosh, you doctors really are so wonderful.
You too, thank you.
No, honestly, you're helping so many men and women, you know, follow their dream. Well, have a lovely evening, and thank you so much for joining us today. And let's definitely do something again soon.
Thank you.
Thank
Bye bye. Nice to
you.
meet you.
See you.
Bye. See you.